If you're a woman on a GLP-1 medication, this might be the most important video you watch this year, because there's a conversation happening right now in exam rooms across the country about these medications in pregnancy, and most patients are being handed a prescription without ever hearing it. I'm a registered nurse, and I make these videos because there is a gap in patient education around GLP-1 medications, semaglutide, tirzepatide, the whole class. And nowhere is that gap wider or more consequential than around fertility and pregnancy. Here's what I see. A woman starts Ozempic, Wegovy, Mounjaro, or Zepbound for weight loss or diabetes. She's focused, understandably, on the number on the scale. Nobody sits her down and says, by the way, this medication can change your fertility. It can interact with your birth control, and it is not recommended during pregnancy. So she finds out the hard way. I want to be clear from the very start. I am not here to scare you off a medication that may be genuinely helping you. These are powerful, often life-changing tools. My job today is simply to give you the information you deserve to have, calmly, accurately, and completely, so that whatever you decide it with your eyes open. Let's walk through it together. Let's start with fertility, because this is where the surprises begin. GLP-1 medications do not directly make you pregnant, but they can improve your fertility, and for some women, dramatically. Here's the mechanism. When you lose a significant amount of weight, especially if you were carrying excess weight or living with a condition like PCOS, polycystic ovary syndrome, your hormones often rebalance. Ovulation that was irregular or absent can return. Cycles that were unpredictable can become regular again. For women who have struggled to conceive for years, this can be wonderful news. But if you are not trying to get pregnant, it means something important. Your body may be far more fertile than it was when you started the medication, and more fertile than you assume. There's a second layer here, and it's about your birth control. GLP-1 medications slow down how quickly your stomach empties. That's part of how they work. But that same slowing can change how your body absorbs oral medications, and that includes the pill. Now, you may have heard the phrase Ozempic babies. It's become a real cultural moment, and there's genuine science behind it. Ozempic babies refers to the wave of unplanned pregnancies happening in women who started a GLP-1 medication and did not expect to conceive. It's driven by exactly what we just discussed: restored ovulation from weight loss, more predictable cycles, and, for some medications, reduced effectiveness of the birth control pill. This isn't just internet chatter. In the United Kingdom, the medicines regulator issued formal guidance after receiving dozens of reports of unintended pregnancies in women using weight loss drugs. If you are on a GLP-1 and you are not actively trying to conceive, this is the moment to take your contraception seriously, not casually. So, what does the official guidance actually say about pregnancy itself? Across the board, GLP-1 medications are not recommended during pregnancy. The manufacturer's prescribing information advises against use and recommends effective contraception for any woman of reproductive age who is taking them. In animal studies, some of these medications were associated with harm to fetal development at certain doses. Now, I want to be honest with you, because sensationalism helps no one. Several recent observational studies looked at women who were exposed to a GLP-1 early in pregnancy, often before they knew they were pregnant, and did not find a clear increase in major birth defects compared to similar women with diabetes or obesity. That's reassuring if you conceived unexpectedly on one of these drugs. But, and this is the critical but, the total amount of human data is still small. We haven't found a problem yet is not the same as we've proven it's safe. If you find out you're pregnant while taking one, contact your prescriber right away. Don't panic, but do make that call promptly. Now, let's say you are thinking about trying to conceive. When do you stop the medication? This is one of the most important numbers in this entire video. The manufacturer of semaglutide recommends stopping the medication at least 2 months, that's about 8 weeks, before you try to conceive. The reason is the long half-life. These medications stay in your system for weeks after your last dose. And here's the piece people miss. During that buffer window, you still need reliable contraception because your fertility may already be elevated. Now let's get specific about birth control, because this is where the medication you're on actually matters. If you take tirzepatide, that's Mounjaro or Zepbound, pay close attention. The FDA labeling for tirzepatide specifically warns that it can reduce the effectiveness of oral hormonal contraceptives, the pill. Studies showed it lowered the amount of estrogen from the pill absorbed into the bloodstream by around 20% and delayed that absorption. So the official recommendation is to either switch to a non-oral form of birth control or add a barrier method like condoms for 4 weeks after you start the medication and for 4 weeks after every dose increase. If you take semaglutide, Ozempic, or Wegovy, the labeling does not include that same specific requirement. In studies, semaglutide's effect on pill absorption appeared less pronounced, but the underlying mechanism that slowed stomach emptying is the same. Here's the clean rule I want you to leave with. The pill relies on being absorbed through your gut, which is exactly what these medications slow down. Methods that bypass the gut are not affected. That means IUDs, the implant, the patch, the vaginal ring, and the injection remain reliable. Now, what about after the baby arrives? Is it safe to breastfeed on a GLP-1? Here's the honest answer. We don't fully know yet. One study looking at semaglutide found it was not detectable in the breast milk of mothers using it, which suggests very little, if any, passes to the infant. But the lactation data is limited. If you're breastfeeding or planning to, do not restart a GLP-1 on your own. Make it a specific, deliberate conversation with your provider. I always want you to walk out of my videos with something you can actually do. So before your next appointment, write these questions down and bring them with you. 1. Given my specific medication and my health history, how does this affect my fertility right now? 2. Is my current birth control still reliable while I'm on this, or should I switch to a method that isn't absorbed through my stomach? 3. If I want to try for a baby, exactly how long before conception should I stop, and how should we manage my weight and health during that gap? 4. If I got pregnant unexpectedly on this medication, what would the plan be? And 5. What's your guidance on breastfeeding with this medication afterward? Write down the answers. Bring a partner or a friend if that helps you remember. You are not being difficult by asking these. You are being a responsible steward of your own body, and any good provider will respect that. If this video gave you something no one else told you, do 2 things for me. Subscribe so the next woman who needs this finds it, and share it. Text it, send it to a woman in your life who's on a GLP-1. She may be one conversation away from information that changes her plans. That share matters more than you know. Here's what I want you to take with you. Knowledge isn't here to frighten you. It's here to free you. When you understand how your medication affects your fertility, your birth control, and your plans, you're no longer at the mercy of a surprise. You're in the driver's seat. That's the whole point of everything I do here. Take good care of yourself. Ask the questions, and I'll see you in the next one.
If you're